Angina is chest pain which occurs when the blood supply to the heart becomes restricted because of narrowing or blockages in the blood vessels around the heart. Symptoms of angina. The main symptom of angina is chest pain. This can 1. Feel like a dull pain, ache, heavy, or tight feeling in your chest. 2. Spread to your arms, neck, jaw or back. 3. Be triggered by physical exertion. Angina itself is not life-threatening, but prolonged chest pain can be a symptom of a heart attack. Diagnosing angina. To diagnose angina, you will be assessed and you may need to have several tests. You will also be asked some questions about 1. The symptoms you experienced. 2. If there were any triggers for the pain. 3. Your family's medical history. 4. Lifestyle risk factors, like smoking, for example. Tests for angina. You might also be given some tests to determine if you already have heart disease or you're at risk of it. 1. Measuring your weight. 2. Measuring blood pressure. 3. Taking blood to check cholesterol levels, diabetes or anemia. If it's thought that you have angina, you might be referred to the hospital for some more tests. These might include 1. Electrocardiogram, ECG, measures the rhythms and electrical activity of the heart. 2. Exercise tolerance test, ETT, measures the activity of the heart during exercise. 3. Myocardial perfusion scan, MPS or MYO view, measures how well blood is reaching the heart. 4. Coronary angiography, shows whether your coronary arteries are narrow and how severe any blockages are. 5. Blood tests, help to identify increased enzyme levels, troponin, which are released when the heart is damaged. Types of angina. The two main types of angina are stable angina and unstable angina. Stable angina is more common. Attacks are more likely to have a trigger, like physical activity or stress. Symptoms of stable angina usually only last for a few minutes after exercise or stress. They can improve with rest and by taking a medication called glycerol trinitrate, GTN. Attacks of unstable angina can be unpredictable and develop without any clear triggers. They might also last longer and continue even when resting. Sometimes, when chest pain occurs suddenly, it's unclear if it's due to unstable angina or a heart attack. Until tests confirm the diagnosis, doctors sometimes call this acute coronary syndrome, ACS. Preventing and treating angina attacks. Nitrates. You may be given nitrates if you have stable angina. These work by relaxing the muscles in the blood vessels so that blood can pass through more easily. You might be given nitrates as 1. Slow-release tablets. 2. A fast-acting spray or tablet. Glycerol trinitrate, GTN, is usually given in a fast-acting spray or tablets. You should keep this with you at all times. If you experience an episode of angina, you can use the spray or tablet under your tongue. The pain should then ease within a few minutes. You can repeat the dose after 5 minutes if the pain has not gone away. If the pain has still not gone 5 minutes after you take the second dose, you should call an ambulance. Beta blockers. Beta blockers work mainly by slowing down the heart. Calcium channel blockers. Calcium channel blockers relax the arteries, increasing blood supply to the heart muscle. If you cannot have beta blockers or calcium channel blockers, you may be given another medicine. Your doctor will discuss this with you. Surgery for angina. There are two types of procedures that are used to treat angina. These are 1. Coronary Artery Bypass Graft, CABG. 2. Percutaneous Coronary Intervention, PCI. The best option for you depends on your circumstances. You should discuss the different options with your doctor. It's likely that you will need to continue taking some medicines after surgery. Coronary Artery Bypass Graft, CABG. A CABG is where a section of a blood vessel is taken from another part of the body. This is then used to reroute the flow of blood past a blocked or narrow section of artery. Percutaneous Coronary Intervention, PCI. PCI is where a narrowed section of artery is widened using a balloon and a tiny tube called a stent. It's also known as a coronary angioplasty. At the end, it is requested you to please subscribe our channel.